my recorder here. I can just read them to you verbatim. These came from the Chinese and they are translated, so there might be something lost in translation. Dr. Lok, what is the prevalence of occult hepatitis B infection?
Well, as I mentioned in my last slide, it is highly variable depending on the population that you study, the country in which the study is done, and the definition and the sensitivity and the specificity of the method used. There's no single answer.
For which patients should the possibility of occult hepatitis B infection be considered?
If you have patient with liver cancer and you don't have an underlying etiology, you might consider that. You certainly need to look for evidence. So if you see patients with liver disease, particularly liver cancer, for which there's no underlying etiology that you can identify, look for occult hepatitis B infection. Certainly in the blood donor setting, if you have transmission of hepatitis B infection, you have to look for a possibility that how did that slip through. It may be because the donor has occult hepatitis B.
How do you diagnose occult hepatitis B infection in patients with undetectable HBV DNA in their serum?
Well, if you have liver tissue, which most of us don't have access to liver tissue, quite commonly for large-scale study, people rely on core antibody, detection of core antibody.
For which patients with occult hepatitis B should prophylactic antiviral therapy or antiviral therapy be considered?
They do not need to be put on antiviral therapy. However, if they need to receive immunosuppressive therapy, then you might consider prophylactic antiviral. The reason for considering a prophylactic antiviral is if they need bone marrow transplantation, receive very potent immunosuppressive therapy such as anti-CD20.
Very good. Dr. Lok, thank you.
Okay.